The Ontario government is looking to further expand the role of pharmacists by adding to the list of minor ailments that they can treat. Simone Gavros is standing by in Waterdown with more on that list.
Well, so far the province says that there have been more than 1 million assessments completed since that list was initially expanded last year. But now there have been ongoing consultations to see if they can expand that list even further to include treatments like lab testing as well as vaccines. Now, this pending list right now includes treatments for sore throats, calluses, minor sleep disorders, and warts, just to name a few. This builds on the 19 minor ailments that the government allowed pharmacists to assess and treat as of January 2023. That includes pink eye, hay fever, cold sores and UTIs, as well as acne, canker sores, and yeast infections. Now, the government says about 99% of all Ontario pharmacies are participating in the expanded program. The Ontario Medical Association has raised concerns that minor ailments may be a sign of something more serious and that a doctor would need to identify that. Pharmacist Phil Hauser says that staff are more than prepared for that.
We certainly appreciate their feedback, but we feel that pharmacists do have the training to be able to make some of these assumptions, and they will be backed up by support and by algorithms and by kind of safeguards to make sure that they do have the necessary training and they are able to kind of make those inferences. And when things do look like they are going to be more serious, certainly there will be referrals. And what we're looking for is a lot of cooperation between doctors and pharmacists to be able to accept those referrals.
Now, the government says that comments will be open on this pending expansion until October 20th.